Diabetes 58. The warning signs of stroke, prevention of complications after stroke. Number 1. Karma. Due to the request of the patient's family in an email asking on how to cure natural waking up with paralysis. I have a relative, 56 years old, who have just had a heart surgery with low blood pressures ranging from 80 to 100 mm mercury. This morning at 6 a.m. he could not wake up and he could not speak. His right hand was paralyzed. The doctor said the left brain is blocked. So I would like to ask, what is the reason? Is it because of his lack of sugar and low blood pressure that causes the stroke? The patient did not eat sugar because I don't live with the patient, so I could not know, but I do know that they are low on sugar. Please let me know what can I do when he's being discharged from the hospital. Thank you. In this opportunity that I have many emails asking on how to treat stroke, I would like to explain the causes of disease and how we need to know to prevent risk for yourself and your family members and friends. For patients who have suffered from stroke, they need to know how to prevent the recurrence that leads to death. Number 2. The causes of blood pressures that we can prevent through the monitor with 2 hands and blood glucose meter. Before, the term stroke is called by high blood pressures, or also called heart attack. It is 2 different diseases. Only happens to those who eat a lot of fat, who have obesity, and instant medicines classify the control disease is as an excess, or simply call them high blood pressures, high fat, high sugar. It doesn't happen to active people who are not with high blood pressures, and the number of these patients is very low. The complementary medicines of the Qigong uses the blood pressures monitors and glucose meters to know who will have one of these 2 cases. Case number 1. Stroke, paralysis, stiffness, stroke, called hypertension, high blood pressures when the systolic of high blood pressure is high from 180 to 220 mg mercury. Anyone who is 240 or higher will die immediately, irregardless. Number 2, stroke, paralysis or heart attack, or so-called high fat lipid, increase the bad cholesterol level, high sugar due to excess sugar that turn into fat cover the heart. With the diastolic pressures from 100 to 120 mg mercury, anyone who reaches 140 mg will die due to a broken heart. Case number 3. Causes of complications after stroke according to the Western medicine. Because of these 2 causes of these many diseases, that the scientific research in the word statistics as below. According to Langhorne P. and his psychics, there are 311 stroke patients. Number 1, recurrent stroke due to ischemic brain, take 9%. Number 2, complications of convulsions of 3%. Number 3, urinary tract infections, takes 24%. Number 4, pneumonia, 22%. 5, impaired weakness, walkable, 25%. 6, complete paralysis, 5%. 7, sores due to single to be bedded. 8, deep vein embolism, 2%. 9, pulmonary embolism, 1%. 10, neuropathy, 34%. 11, depressions, 16%. 12. Anxiety, 14%. 13. Emotional disorder, 12%. 14. Dementia, 56%. According to Diabete and his team, supervising on 489% with stroke. An acute stroke has 16% patients with complications similar to the Langhorne studies, but with earlier complications after stroke and an additional complications of following. Number 1. Painful nerve damage 2 to 6%. Number 2. Dysfunction genital ability 36%. Number 3. Visual disturbance 32 to 55%. All the complications after treatment with strokes. Number 1. Recurrent stroke 19.2%. 2. Convulsions 9%. Weakness completely 6%, not entirely 80.7%, and not weak 13.3%. 4. Depressions up 36.9%. 5. Dementia 52.4%. 6. Muscle stiffness 26.1%. 7. Disorder urination 11.8%. 8. Urinary tract infections of 26.1%. 9. Pneumonia 11.3%. 10. Death 16.3%. 11. Joint pains 28.1%. 12. Dysuria 42.9%. 13. Hypertension 42%. 14. Diabetes 69.2%. 15. Dyslipidemia 44.8%. 16. Atherosclerosis 36.4%. 17. Cardiovascular diseases 64.7%. 18. Vascular diseases 75.9%, and minor vascular diseases of 38.8%. Two catastrophic diseases. Warning signs of stroke according to the experience of Qigong. Two catastrophic diseases with the symptoms of hypertension, high fat due to high systolic blood pressures and high diastolic blood pressures. We have noticed long ago, if we're lucky to not dead, we will suffer from paralysis. With paralysis, limbs, hard jaw, limbs are hard to move. This case is rare today because the Western medicine has prevented these two diabetes. However, today the number of patients who suffer from paralysis often suffer without that, are paralyzed, helpless, half body paralyzed, unable to walk. But few know that the cause of this is because of low blood pressure, low blood sugar, low heart rate. But continue to use the antihypertensive drug according to the Western medicines to maintain it as low as possible, so that the body, apnea, lack of air, lack of sugar, become paralyzed. For those who are afraid of high blood pressures, diabetes, should abstain from diets such as abstain from sugar, so that the body is anemic, lack of sugar, low blood pressures, and that can complicate into severe stroke. And the Western medicine's treatment focus only on the symptom rather than healing the diseases, which miss these patients. There are two major problems. One of which is that, so that the patient would not recur, the doctor allowed the patient to continue taking blood pressures and glycosemic agents for life, even though their blood pressure and blood sugar were very, very low. Number two, perhaps the doctor already knows, but the medical industry does not want to lose profit when patients recover from drug use, so no doctor dares to tell the patients to stop taking drugs when blood pressures and blood sugars remain stable. They fear of losing their license, so they take the reasons. If the patient stopped the drug, the blood pressures and blood sugar would resurrect to scare the patient, so the patient would not dare to quit the medication, which might cause the stroke that may kill the patient when they sleep. Otherwise, the patient will paralyze limbs, deform mouth. Signs of stroke below due to evidence of low blood pressures and low blood sugar. First, there are two diseases and sudden stroke due to hypoxia, amnesia, such as the email case above, as above. Case number one. Warning signs of blood sugar when it is low in the evening and high in the morning. And there are three causes. Cause number in the case in the absence of hypertension and diabetes, low blood pressures, low heart rate, low blood sugar, for example, 100 over 60 milligram mercury, low heart rate of 60, blood sugar at night before going to bed of 100 milligram per deciliter, in the morning at 130 milligram per deciliter. The results of these blood pressures and blood sugar are considered good by the standard of the Western medicines, so that's why we all want this result. But no, in the long run, it can weaken the body, lose weight. If not die, will become paralyzed, unable to move. Western medicine could not find the previous cause. They could only find when the patient suffered from cerebral paralysis and deliberately neglecting the cause of the lack of brain nerve feeding the pathway according to the medical research. The human body needs 180 gram of yellow sugar per day, and it will be used for neurological needs of the brain to function. At 144 gram, the heart needs 36 gram, and the baseline for the heart to function with a heart failure, even when fasting or at rest, is from 100 to 140 milligram per deciliter. Therefore, a person with low blood pressure, low blood sugar, 100 milligram per deciliter, before going to bed, the heart muscle lacks sugar to maintain the life force, so the brain function must regulate the heart to take the muscle from other part of the body to nurture the heart to make sure they have sugar of 100 to 140 milligram, and to make sure when the patient wakes up the blood sugar is still safe in the morning when they wake up in order to operate. But the body loses the meat gradually, losing weight until there is no more sugar in other part of the to support the heart, so that the baseline of sugar decrease. And the symptoms is memory loss, brain atrophy, dizziness, gradually throbbing after a long time, headache, and moreover, the person will not wake up anymore, or paralysis, or mute. And just like a pipe when the pressure is too high and the pipe will break. When there is a stroke, then we need operation, otherwise the blood will explode. In the case of a stroke, different from this case, where the cerebral embolisms, there is no sugar, so that this drink that cause blockage. So even if the surgery it is useless, the patient will lose more blood. We need to note this case. We have to ask about the lack of sugar. The blood sugar is low every day, but why do we wake up when the wake up is higher? This is because the sugar that is for the neurological function of the brain and is losing until the brain dies or the heart stops beating. In the middle of this state, the stroke occurs and the patient is, if not lucky enough not to die, the patient will have the stroke in the night. And it's not controlled, not statistic. The number of people who die of sudden stroke due to lack of sugar. Because the patients are afraid of diabetes by the media of Western media, and they do not accept the stroke due to lack of sugar. So you should know that Western medicines has deceived us. No one will consume diabetes medicine anymore if we know the truth. The remedy. We must compensate the lack of sugar and to the blood to rehabilitate the heart and the brain by drink plenty of sugarcane juice from 1 to 1.5 liters a day. Eating food we pay attention to the treatment. When the body lacks sugars, the lips or the mouth will deform. So when the mouth will be less distorted, we need to drink more sugar cane. It has sugar, it has B12, it has protein. And then we rub the face for the blood sugar to feed the eye and the facial nerves. Next stroke, and so that the sugar will be distributed evenly. And then feed them with food and do exercise to regulate the blood over the body. So that the body and all of the cells will have enough energy, the sugar. So that to prevent dizziness, prevent brain cancer. In case of black sugars with less than 100 milligram, men can call the diastolic hypertension of 100 to 120 milligram, heart rate lower than 65. This is also a mistake of the Western medicines that they assume higher sugar will turn into excess fat, causing coronary atherosclerosis, causing stroke such as hypertension. In this case, with low sugar, low fat, or so-called low blood lipid, they did not consider the lower heart rate is the low pumping heart speed due to body's coldness, thick blood, and due to lack sugar. In this case, we do know that there are symptoms such as short of breath due to low heart rate, low blood sugar, and systolic blood pressures on the right hand high. And it is called ischemic, myocardial ischemic. In this case, it requires immediately emergency by drinking one warm glass of water mixed with 4 teaspoons of sugar. Finish with coughing immediately 3 times. And it's increase the systolic force, pump the blood into the heart, and lie on the bed to warm the body. And then when measured, we can see it is from um, from 100, it will be down to 70 to 90. How to prevent from recurrence. After eating, if the blood sugar does not satisfy the standard of 140 to 180 milligram per deciliter, does not compensate with the heart rate of 70 to 80 and does not compensate with the body temperature on the palm above 36 degrees Celsius. Then the body still lacks its true sugar. Even though the high blood sugar is high, it's still the sugar taken from the bone, muscle and brain, resulting in a stroke due to low heart rate, high blood fat obstructing the heart, and blockage of blood to the brain. In the evening, when there is indigestion before going to bed, low blood sugar, but waking up with high blood sugar of 150 to 220 milligram. In this case, most of the people who abstain from sugar will face. After eating, they will feel sleepy. Binging excess acid in the stomach. The cause of indigestion is the blood sugar from the left hand is higher than the right hand is because of the high blood pressures and does not need the requirement of 140 to 180 milligram per deciliter for food metabolism. And sleepiness is so due to lack of energy. When they sleep, in the morning, the blood level is at the standard of fullness. We need to pay attention to this point, that instead of at night, the function of stomach is to work to metabolize the food into the tonic, and then the blood pressure in the left hand when we wake up will be lower than the right hand. But because of lack of sugar for the stomach to metabolize food, to digest food, then the stomach is still full. Only waters flow from the butt. We see the bottom of the stomach. And when we wake up, the body moves, and the sugar will be run down through the intestine to the blood. So that's why the blood sugar high. But the food stay intact in the stomach, which we feel full. That's why the blood pressure in the left hand is high, even though we haven't eaten anything. It should be lower than 130 millimeter per mercury. On the contrary, in the left hand and right hand. To prevent excess stomach acids from eating digestion causing esophageal, gastric ulcer or stomach cancer, or liver enzyme, or liver cancer. If we have this situation where we wake up in the morning, we have high left-hand blood pressures and higher sugar, then we need to exercise to metabolize the food, to digest the food in the stomach, so that the standard lower than this, so that we can eat again. If somebody is lazy, they keep on eating, and it becomes disorder of metabolism, blood pressure disorders, and can cause the cerebrovascular. We must know the causes of coronary is due to high blood pressures, high blood lipid. When the systolic blood pressure is 180 to 200 milligram. If the systolic blood pressure is less than 160 milligram of mercury, then there is no stroke. Blood-brain when high from 100 to 140 milligram mercury, then this is the sign of stroke due to coronary atherosclerosis if the blood pressure is high and obese. In contrast, systolic blood pressure is lower than 140 milligram, then it's not a stroke, but the diastolic 100 of 120 milligram. Low blood lipid, low heart rate, below 65. Is because the body temperature is low. Is ischemic heart disease with high blood pressures up 200 to 400 milligram per deciliter. Is because of the effects of the medication of hypoglycemic drug drawn from the brain. The cure is to drink more sugarcane juice, or one warm cup of sugar, taken right after the meal. Qigong we have explained as such as math. High blood pressure but low body temperature is considered negative. So we need to drink sugar to increase heart rate. Call positive sugar. And after doing the positive and the negative math problem, the positive plus and minus, the glucose will go down. So the glucometer cannot distinguish between the positive and the negative sugar. So we are just lab rat to consume diabetes medication and the oral hypoglycemic drugs, and it will increase stroke and cancer when people realize they are too late because of their ignorance. 2. Other common cases. Stroke due to anemia and sugar. Western medicines also call it stroke. In fact, that is just not insufficient blood to the brain, causing paralysis of limbs when the systolic blood pressure is lower than 100. B. Stroke paralysis due to myocardial ischemia, creating is also called as heart attack. But in fact, it's just ischemic heart. When diastolic blood pressure is lower than 60 or even below 50, then the heart stops beating. C. Stroke due to hypoglycemia when taking low blood sugar medication to less than 60 milligram. Makes the patient dizzy and weak limbs when the pressure has reached below 55. D. Stroke due to fear of diabetes. So abstain from using sugar, and they think they don't have diabetes, so they don't buy glucose meter and blood pressure monitor to monitor the blood pressures and blood sugar. These victims of this case often have more stroke than other taking drug. B. How to monitor using thermometer and glucometer to prevent diseases. As long as we know how to monitor the diseases with blood pressure monitors and glucose meters according to the medical industry standards, then we don't need the medical treatment. It is the medicines of endocrinology treatment that created many other diseases due to the complications of diabetes. In the medical industry, it has successfully achieved the goal of making profit from many people, create drugs that cure many other diseases as a result of low blood pressures less than 6 millimole. The lower the blood sugar, the more chronic incurable diseases, and the patient had to take lifelong medicines, and also lead to other diseases such as number 1, heart failure, heart attack, stroke, and recurrence. When blood pressures of a low heart rate, patients treated with blood pressure medicines are treated by doctors, preferably because the heart rate is just like the water flows in the warm summer. The heartbeat also circulates easily with the heartbeat. When it is colder, the water denser, the blood will be slower, at the speed up to 55 to 60. This is the main reason causing hypothermia. And then this patient had to take medication to lower the heart rate of 95 to 108, causing blood clot. This is due to the medication that the patient is taking. And this is not very noticeable. They fully rely on the doctors. But the patient needs to check their disease every day before it's too late. 2. Clogged brain blood circulation due to brain ischemia. When diastolic blood pressure is lower than 60, ischemic low heart rate below 60, low blood sugar 4.5 to 5.5 millimole per liter, thermometer below 33 degrees Celsius, cold solid blood, dizziness, lightheaded, fall, stroke. Due to thromboembolism. 3. Night stroke due to hypoglycemia from 4.0 to 5.0 millimole, or from 72 to 90 milligram per deciliter. Before going to bed, it is forbidden to take hypoglycemic drug for people who are taking drug. Before going to bed, you need 140 to 150 to have enough glucose to feed the brain, so that when you wake up in the morning, you will lose it and it will turn into and it will be metabolized into ATP. And your blood pressures will be down above 100 milligram. And there will be no stroke or recurrence of stroke. Just pay attention and to distinguish between those with low blood sugar and high when they wake up. You can see by using the blood pressure monitor. On left hand is higher than the right hand. Left hand is higher than the right hand. It is the sugar from the food that is being digested into the blood.
Nên không còn đường trong bao tử. Còn trong đêm chức năng thần kinh não tiêu thụ khoảng 40 đến 60 mg trên decilit để điều chỉnh chức năng nội tạng, nên đường huyết bị thấp vào buổi sáng khi đói bụng. Khác với đường huyết cao tối trước khi đi ngủ.
4. Shaky hands, slight seizures due to a drop in blood sugar between 4 to 5 millimole per liter or 72 to 90 milligram. Keep in mind that the medical research industry explained that the body needs 180 grams of glucose every day for the heart muscles to contract, for blood circulation, and for neural function of the brain to control. We need 36 milligrams. All metabolic function of the internal organ needs 144 grams. The medical industry hide this information, so when abstaining from sugar, the brain will have signs of dizziness, confusion, lightheaded, limbs, irritability, nervousness, anxiety, low heart rate, cold forehead, sometimes cold sweat. Eat promptly. Take 4 teaspoons of sugar, of yellow sugar, and this situation will disappear. And it is not Parkinson's. Western medicines mistakenly treat this as Parkinson's disease. Distinguish hand tremor different from Parkinson's disease symptoms. If the hand on the table not shake, then it's not Parkinson. And the cure is to take enough sugar of 8 millimole per liter or 144 milligram per deciliter. And for rhythm applause exercise and hand turn, this will be cured. Watch the YouTube video entitled Parkinson's Disease Cure. 5. Day sleepy, night insomnia due to low blood sugar from 5 to 6 millimole. Sugar metabolized in the body into energy of ATP. This is the energy basis for cardiovascular circulatory, with a basic blood glucose of 100 to 140 milligram per deciliter, and the nervous energy for motor functions from 140 to 180 milligram per deciliter. The body needs a lot of energy. The higher blood sugar than 200 to 300 will be used when exercise turns into sweat. Then it will be turned to normal as 120 to 130 milligram per deciliter. So if only 5 to 6 millimole per liter or 90 to 108 milligram per deciliter, then the heart will fail. So the patient will be sleepy during the day, unable to work, yawning, drowsiness, because the neural function has to work to regulate the function. So that's why the patient will be sleepless and something cold sweat at night. The person are very exhausted. This will cause heart failure, leads to nervous breakdown, loss of sleep. In fact, the cure is the sugar. We can try before going to bed. Take 4 teaspoons of yellow sugar. Then we will be cured from cold sweat. For children at night, with sweat. Also take 1 teaspoon of sugar, yellow sugar, to cure the cold sweat at night. The reason is also because of heart failure. If we don't have enough sugar, our sleep will not be maintained very well. It's because of the lack of sugar.